Okay, thanks for joining me here this afternoon. We're going to talk about medical waste management, what it is, how you need to deal with it, why you need to deal with it, okay? So, when you talk about medical waste, the terminology is really important. Like in your world, words matter. It's called universally medical waste, but you might hear it by a number of different terms. You might hear infectious waste, biohazardous waste, biomedical waste. There are all kinds of different forms and nomenclature and things like that. But for our purposes, we're just going to use this generic term, and then we'll get into the specifics. Now, are there risks associated with medical waste? Yes, there are. But why are there risks? So we're going to do a little bit of infection control 101 here first, right? So you know, as clinicians, that there are 4 factors for disease transmission, right? You have to have 4 specific things present in order for disease to be transmitted, right? So the first one is you need a pathogen. You need the presence of a bug, right? Well clear on that? The second thing is you not only need the presence of a pathogen, but you need it in a sufficient dose. A little bug here, a little bug there isn't going to hurt anybody. But you need some sort of concentrated quality, right? All right. These in and of themselves don't matter a whole lot. But the third thing is, this is where it gets more to your world, you need a susceptible host, right? You need someone whose immune system is not able to counteract the presence of the pathogen or a dose, right? Now, the fourth thing you need, because you need one more, you need a portal of entry. Now, this is really the most important factor involved here. Any one of these items that are not present, we don't have the risk of disease transmission. But you have to have all 4. Now, people talk about the risks of medical waste, infectious waste, biohazardous waste, biomedical waste, and it is much more of an occupational exposure risk than it is an environmental health risk. All right? If you accidentally, or someone, put a red bag, we'll get to that in a minute, out on the street and somebody walked past it, their risk of disease transmission is very low. Would you agree with that? Okay. However, if somebody is stuck with a sharp, that risk goes up tremendously, right? In fact, there are no documented cases of anybody, a healthcare worker or a landfill operator or a waste services provider, seroconverting to accepted disease from general exposure to medical waste. It has not happened. Now, in this day and age, we have coronavirus. A couple years ago, we had Ebola. Back in the day, we had hepatitis B. But still, we have specific modes of transmission, right? So, 4 factors. Those are the most important, right? Now, once we know what the risks are, then, from a regulatory standpoint, we look at what is it that we're talking about? So what actually comes under the definition of medical waste. And a little historical footnote, in some parts of the country, it's still called infectious waste. But a lot of places are not doing that anymore. It's the exception rather than the rule. The reason is, when there was an improper disposal of infectious waste, in order for the person to be prosecuted for a violation, the district attorney had to prove infectivity. Well, what happens with, let's say you have this improper disposal that's in a red bag and it's put in an evidence locker for a month. What happens to the bugs? They die, right? So you couldn't prove infectivity. So just as a little footnote, that's one reason why it's not called infectious waste anymore. We don't have to prove infectivity. But with these things present, there is a risk. So, now what are we talking about? There are very specific types of what falls under this definition of medical waste. The first one is we have cultures and stocks of etiologic agents. We got lab cultures, right? Second, we have blood and body fluids. Now, in this case, it's been determined that exposure to dried blood is not a risk. So if you have a 4x4 and you've removed an IV, that little 4x4 that has a spot of blood on it that's going to be dry in a heartbeat does not fall into this category. In fact, some regulations actually specify it's got to be fluid, wet, dripping. If you can picture like a sponge and you'd squeeze it and it would drain out, that's what this encompasses. Bulk fluids, you know, things like that. Next thing, I know you don't deal with this so much in your practice, but pathological waste, tissue, anatomical waste, biopsy, things like that. That's what's included in here. And the last thing of substance, there are subsets of all this, are sharps, right? So, would you agree that these items all potentially could meet the 4 factors for disease to be transmitted and pose a risk, right? Okay, so we've got this down. We've got the universe of what we're talking about. We identify what the risks are associated with it. Now, what are you supposed to do with it? Well, once you identify which specific items fit these categories, which is going to be different depending upon the type of facility. Whether you're a clinic, a hospital, outpatient center, whatever it happens to be. This needs to be more substantiated to your particular practice. Once you do that, you separate it out, right? And you containerize it separately. You do that in red bags, right? You with me on that? And sharps containers. Really simple. Soft stuff goes in here. Any item capable of puncturing or cutting, blades, scalpels, broken glass, needles, syringes, all that falls under this category. Okay? So, if it goes in a red bag, that red bag is tied securely. I should say secured at the top. You don't want to tie it off because you need more of an airtight seal. So you grab it, tape it, and then it goes in a container which is eventually picked up by your service provider. Sharps go in a sharps container. It's usually red. Doesn't always have to be, but for the long amount of sharps waste, it is. And then the sharps container does not need to go in a red bag, but it does go in the same container. Now, once this is picked up, your provider, who has to be licensed to transport medical waste, will take it to another licensed facility, usually a medical waste transfer station, where your waste then is combined with that of several other institutions, and then it goes to another permitted medical waste site for treatment. 90% of the regulated medical waste is autoclaved. It's steam sterilized. And then once it is rendered non-infectious, treated, it will go to a landfill just like the regular residential refuse goes. Okay? Now, a couple of other items that are considered medical waste but are in kind of a category by themselves would be trace chemo, and pharmaceutical waste. Okay? These items come in a little bit of a different context than these do, because there is bulk chemo and there's trace chemo, right? Bulk chemotherapy is the drug itself. Trace chemo would be the products or the items that are contaminated with that small amount of chemotherapy. Gloves, gowns, anything that might have come in contact with the drug. That's considered trace chemo, and it's not a hazardous waste. One thing that's important to remember is medical waste is its own category. When you talk about hazardous waste, it's something different. That's chemical hazards, other things. So you have trace chemotherapy waste, and then you have non-hazardous pharmaceutical waste. These are drugs, not supplements or non-prescriptive treatments. These are drugs that there is a portion left in the syringe, the vial, whatever it happens to be. This and this, instead of going to an autoclave, is separately containerized, and it ends up being incinerated. Because only incineration will destroy the chemical compounds in these products and the analogs. So autoclaving won't do it. Okay? So, we've identified what the risks are. We talk about the definitions, the categories, which again, in your practice, you have to determine the specific items that would fall under here. They're containerized, they're sent out, and they're destroyed. And if you do that, you will protect yourself and protect the general public from any exposure. So, with that, thank you very much. And I think we stuck pretty well to a short time frame.